Namaste, this is Hrushikesh Takbhate from Palace, and in this video we are going to talk about the stages of COVID-19 infection. In case you got COVID-19 coronavirus, what are the stages of this infection and how deadly this virus is? So let's start. So in the last video, that is episode 1 of Understanding Second Wave, in that episode we talked about what tests to do in case of COVID-19 symptoms. Now in case the tests are positive and you get COVID-19. So what are the stages of this COVID-19 infection? So first stage is home isolation or isolation ward. Now in this stage there are two categories, symptomatic and asymptomatic. In symptomatic category, if you have mild fever, cough, vomiting, chills, fatigue or diarrhea, these are the symptomatic stage 1 of COVID-19. Asymptomatic is when you have tested for COVID-19 positive but you have no symptoms of COVID-19, even your CT scan of chest is clear. So this is asymptomatic and symptomatic stage 1 of COVID-19. Now in stage 1, symptomatic or asymptomatic, these two are easily recoverable and the person with infection can be fit and fine also. But in stage 2A and stage 2B, these are the two categories of stage 2 of coronavirus infection. Now in stage 2A, the person with coronavirus gets moderate but frequent fever, gets cough, and his or her CT scan comes with lesions presence. Then in second stage 2B, in this stage the person gets pneumonia and his or her oxygen level is below 92%. Now if you test with oximeter, which is a small device that tests the oxygen level of human body, in that you can also get readings less than 92%. In that case you have stage 2 of coronavirus. So it can be interchangeable. You can go from stage 1 to stage 2 or directly stage 2. In this case there is no the climbing or lowering of ladder. Now after stage 1 and stage 2, there comes the stage 3, which is more dangerous and more serious stage of COVID-19 infection. Now the person with coronavirus and at stage 3 has to be moved in ICU ward. Now this stage can cause acute respiratory distress syndrome, also minor kidney injuries, and also the high risk injuries like heart failure. Now these are the very serious byproducts of this stage 3 and which can be straight to person's life. Now these are the 3 stages of coronavirus infection. Be sure, and I hope no one is at any of these stages and is in their home safe and sound. So that's for the video. If you like it, please like and subscribe. This is the episode 2 of Understanding Second Wave, in which we talk about the stages of coronavirus infection. The first episode was what test to do, when test not to do, and what is the difference between CT scan and CT score and CT value. So check that out in the I button or in the end of this video. In episode 3, we are going to talk about the cures and therapies which are in use for the cure of coronavirus. So stay tuned for that. Subscribe to the channel, press the bell icon so that you will get notified. This is Hrushikesh Takbhate from Palace signing out.